Brunel. I'm Louise Brunel. I'm the older driver subcommittee chair, and I'm really delighted to welcome you all to this very, I believe, good presentation we will have. I'd just like to say a few words about our subcommittee. The philosophy or the vision we have is for people to drive safely for as long as possible, but also at the same time to think and try early alternate mean of transportation so you don't get caught by surprise. The important thing is mobility. That's what is very important. Sure, driving is convenient, but mobility is key. So over time, we've tried to bring you pertinent information related to topics related to older drivers. We also had presentation done by, we've done presentation with Safer Roads Ottawa and the Ministry of Transportation. In April, as you might have seen, we have two upcoming driver refresher course, 55 Alive, at the Council on Aging, one in French, one in English. And in the past and in the last fall, we've done a CarFit event. I'm not sure if you're familiar with CarFit. It's a program that started in the United States and was brought to Canada by the Canadian Association of Occupational Therapists. CarFit is a 12-point program, a free program. It takes about 20 to 30 minutes. And it's to find the best fit between you and your car for safety and comfort. It's to find the best adjustment. Like a lot of people don't know the distance that to the airbag. They don't adjust their headrest properly in case there is a collision. A key aspect is also mirror adjustment of the rear view mirror, lateral mirror, to try to reach a vision, 360 vision. You still have to do your shoulder check, but really, if your mirrors are well adjusted, you should have a vision 360, see all around your car. Also, another aspect is eyesight above the steering wheel. Some people are sitting too low in their cars, so they don't have sufficient vision. So it's different aspects like that we look at. And we are intending to have one, hopefully, another one in the spring. So, and seeing how popular this topic is, I hope that we can recruit some more subcommittee members, because we are always searching for more input, more people to participate in this. So feel free to contact us later on today or this week if you're interested to take part in the older driver subcommittee. So I'd like to introduce you, our speakers for today. I'm very delighted to have them talking to us about high tech. So we have Kathleen Van Benten. She has a degree in occupational therapist and a doctoral degree in cognitive science. She provides clinical research and policy development expertise in older driver safety. She designs and carries out human factor experiments that include high-fidelity flight simulation and simulated and closed-track driving protocols. Now, also, you can find, I cut some aspect of the bio, so if you want to see the complete text, you can look at the Council on Aging website. We also have Dr. Bruce Wallace. He is an executive director of the Age Well National Innovation Hub on Sensors and Analytics to monitor memory and mobility, SAMS 3, I would say in French, au cube. and an adjunct research professor at Carleton University, and an affiliated investigator at Bruyère Research Institute. He has a PhD from Carleton University. He leads SAMS3, which is a collaboration between the Bruyère Research Institute and Carleton University in partnership with the AgeWell Network Centers of Excellence, focus on research and innovation project using technology-based solution to enable an aging population to maintain a healthy and independent lifestyle. We also have Dr. Jocelyn Kaler, is a senior research scientist at the National Research Council, Canada's Flight Research Laboratory. Dr. Kaler's research focuses on the use of physiological measures to study aircrew alertness, fatigue, and performance in real and simulated flight. So I leave the stage for our three speakers.
Thank you. Good afternoon, bon après-midi. We're very happy to be here with you this afternoon to talk about older drivers and new automotive technology. So by 2050, a quarter of Canada's population will be older adults. That's 85% of these people wish to age in place at home. But this isn't always easy. Maintaining our connections and activities in older age is essential to health and happiness. And transportation is a key element of this. And I know that you already understand this, given all the excellent work that the Council on Aging Ottawa does in this domain. And I see some really nice potential synergies between our work and yours. So sensor networks for safe and engaged mature drivers, or SenseMD, is a 3-year project that will develop tools that can support older drivers in making healthy choices about their driving in order to prolong their safe driving years. So the technology behind SenseMD makes use of sensors and networks that already exist in vehicles. You know, we always hear about our cars having computers, but it's more like the car kind of is a computer in a way. So we're all starting to get familiar with advanced driver assistance systems, or many of us are, and you may be enjoying it or avoiding it in your vehicle. So these include things like park assist, lane keeping assistance, or adaptive cruise control. In the SenseMD project, we'll pull data from these sorts of systems for interpretation by artificial intelligence programs to identify changes in driver performance and risk of accidents. So results of the SenseMD project will allow drivers and the safety team of their choosing to be informed of early changes in driver performance trends, so that smart choices, such as taking driver refresher courses or modifying when and where you drive, can be made. In this presentation, we'll talk about our research and what we've learned about older drivers and their use of ADAS features, and in particular, their trust levels that older drivers have with this technology. We're very interested in your opinions on the most feasible and acceptable ways that this driving data can be collected, stored, and shared, with the goal of extending and optimizing our driving activities in older age. So for the agenda, we'll do an overview of the project. We'll talk about stakeholder focus, which is super important to us. We'll describe some of the team's findings in relation to older adults and driving technology. We'll conclude, and most important of all, we'll have questions. We want to hear your questions. You can use the chat to ask questions. We may answer some of them in line with the presentation, or maybe we may hold some of them onto them till the end, but you can also definitely please ask questions after the conclusion. So next slide. What are the goals of our project? The SenseMD project addresses the issue of mature driver safety and the heightened risk of accidents and isolation. Aging brings natural and illness-related health declines, making mature drivers at risk for driving accidents and injuries. Furthermore, unplanned driving cessation causes isolation, leading to increased risk of dementia, poor physical and mental health outcomes, and reduced ability to engage in social, physical, or other activities. So the SenseMD project aims to provide a solution for kind of a key missing element in the current driver assessment regime: direct knowledge of changes in driving risk based on actual driving. As it stands, clinical assessments by a physician that are infrequent and they may only indirectly measure the skills required for driving. The SenseMD project offers a technology-based solution that will deliver information regarding changes in the driver risk to the mature driver, their family, caregivers, and others supporting them, while keeping mature drivers central to information sharing and driving career decision-making. So in summary, we're looking to leverage the advances in automotive technology to support the NRC's goal of tackling challenges faced by mature drivers and the Canadian Institute of Health Research mandate to mobilize knowledge with potential for large-scale uptake. So the SenseMD commitment to equity, diversity, and inclusion will ensure that vulnerable and underrepresented populations are included as research participants, consultants, advisors, and end users. The engagement part is really important to us. Now I'll hand it over to Bruce to talk about more about the project.
Thank you, Jocelyn. So I just want to back up one slide, Kathy. Thanks. So I just want to talk about sort of some of the technology and what we're thinking about. So if I sort of start this picture, we'll sort of start in the bottom left corner. The idea here is, how do we take sensing and knowledge of what's going on in the car and how it's being driven and use it to build models? And I guess I'm the engineer in the crowd. I come at this from the standpoint of, we see all of this stuff in the press about autonomous vehicles and how they're going to drive themselves. I will go out on the limb and say I'm never going to drive a car without a steering wheel, and I'm actually willing to say my children will never drive one without a steering wheel. The technology needs a lot of work to be at that level. So the reality is, we are going to be driving cars. But the interesting thing is, there's a lot of sensing being put in the cars for safety reasons, and so they can drive themselves in some situations, and we can use that knowledge to actually potentially understand how the driver is driving the car when they're driving it. So the idea is, we'll start from those sensors. We'll come back to them later in the presentation of what some of them could be. We'll build some models, as it says. We go towards the top of the picture, where we're looking at analyzing that data and looking at changes in driving leading to risk prediction. And then the absolute most important thing, as we come down the right-hand side, is, how do we communicate that knowledge to the relevant people? And there's a huge question that's part of the project of, what do we communicate? And even probably more important, who do we communicate it with? Within the project, we're going to look at sort of 3 different methods of doing the work. We have extensive data sets of driving data that we're going to be able to work with right out the gate. A historical set created and captured out of the Ottawa Hospital from one of our research partners called the CanDrive data set. We also have a research partner, the CAA, and we have a data set of just short of 30,000 drivers of all ages in that data set, but there's a large wealth of those drivers who are, above 60. I think we figured out there's 600 of them that are over 90. So we'll be working with that data set. In addition, we have access to simulation, so we'll be able to do driving simulation, and more potentially fun, we have access to the autonomous vehicle track in Ottawa, which will allow us to actually do in-car driving and driving assessment. Okay, so I guess we can move on to the next slide. So I covered some of these, but we have a number of people who are engaged in the project and working with it. We have a direct relationship with the CAA. As I just said, they've given us access to a data set of anonymized data that we can work with. That'll be really interesting. Canadian Association of Occupational Therapists, a critical role within driving and driving assessment in general for anybody who is, where aging is leading to questions about driving ability. Our research partner, Briere Continuing Care and the Briere Research Institute, I have an appointment there, but that is giving us access to the physicians and the other clinical expertise who are also engaged in the driving discussion and understanding well-being. The Dementia Society of Ottawa and Renfrew County, for obvious reasons, because cognition is, in addition to physical ability, or to the questions that come up around aging and driving ability. And lastly, but probably most importantly, the older adults themselves. So Experts by Experience is a program the National Research Council is running to make sure that projects like this one actually have somebody engaged in it. We have somebody. Our own research group, we have a community advisory committee. We have a member of that committee engaged in the project. This presentation ourselves and others. So if we move on. So I talked about the data sets. I'll show you later in the presentation some sizes. The CAA data set is just short of 30,000 drivers. The CanDrive data set, it's about 250 drivers in Ottawa. It's a little bit dated because it was about 4 or 5 years ago that we stopped collecting that data, but it is a one-of-a-kind data set that was collected because we have up to 7 years of data for some drivers. Everybody in it was over 70 when they entered the study. I got a PhD out of that data set, so I'm very happy with it. It's a great data set. We'll keep working on it. Driving simulators, at the top is the newest simulator, which is actually physically sitting at the Briere Research Institute. We have other simulators. And then lastly, the Lexus at Area XO. So it is a research autonomous vehicle. It has technology that is not road ready for the general roads, but we can also use it as just a car. And we will continue to use it in studies. So if we move on to the next slide, I think Kathy takes over, right? Nope, me. I'm sorry, I forgot about this slide.
Yeah, one more, Bruce.
One more. So one of the questions which I have been intrigued with is, we have these conversations about, new safety features coming into cars. And this is sort of the lens we're looking at these autonomous vehicle features with. Will they make cars safer? So if you actually look at the historical research, seatbelts became mandatory, and then they looked at how people were driving afterwards, and they realized that people were now reduce their following distances. We're driving closer to the vehicles in front of them. We introduced, as engineers, that's why I say we, anti-lock braking systems so that your braking performance became better. And then they went and looked afterwards, and everybody had tightened up their following distances. They introduced in some areas wider roads to make the lanes wider for various safety reasons. And then they went and looked, and people were driving faster. So there's an interesting contradiction between human behavior and safety design, where it seems that, we try to make things safer, and then, people go a little faster, they follow a little closer. So I think that kind of lens we have to look at with any of these new autonomous features that are coming at us. Will they actually make it safer? I'm not sure. So with that, now I'll turn it over to Kathy.
Okay, thanks, Bruce. Before I continue, are there any questions in the chat that we should look at for a sec? We're good? Okay. So, as Bruce mentioned, we're very interested in ADAS, or advanced driver assistance systems. Firstly, there's, the big question, can it actually make driving safer for not just older drivers, but every driver, but in particularly older drivers? Does it mean that perhaps using these systems might prolong driving retirement? So you might, drive even longer. So that's another reason we're interested. And then, of course, we're interested from the sensor perspective. Every ADAS system, like every feature from ADAS, requires sensors. And so as Bruce will get into even a little bit in more detail later, if we stream all that data and then crunch it with some really nice artificial intelligence, can we then use that to really identify drivers for themselves, or perhaps others, whether their driving risk may be getting a bit of a problem, or if you're doing great, keep driving. That's an important part of this. So another thing, I thought I would just go back to basics for 1 second and just talk about what do we mean by ADAS, and what are these different features. So in one category, you can think of having these visual and auditory warning or information systems. So, you know, I really like in my backup camera, I like the lines that kind of turn red where I know I'm getting too close to something. That would be a feature, and it would be a visual information system. I also really like the blind spot warning. I find that really handy. You know, when there's a beep, I'm sure it saved me a few times where it's like, oh, I didn't notice that car. And so that would be another kind of information system. And then on the other side of this category would be operational features, where the car is now actually in control of where it's going and how fast it's going and what direction. So for example, park assist. The car is actually doing the driving, or adaptive cruise control. It's changing the speed to maintain a safe distance, following distance. And these or lane keeping is another example. So I just noticed somebody in the waiting room. So if somebody wants to let them in, or I could do that for a sec. Okay, so what does the literature show us? So even before we get into all our kind of cool findings from our most recent study, the literature will say, for example, a large study that the AAA did in the States with thousands of drivers, they found that there wasn't a decrease in risk as people used ADAS. So, you know, what's happening there? Other reviews did show some what I kind of called soft safety benefits. So, for example, people report having lower stress when they're driving with these features, or it required fewer backup attempts when they were using their park assist. But what you'll actually find is that this isn't in the slide, but you'll find that the people who use these features were more likely to be men. Women did use them, but it was a higher chance that it was a man using it, and also higher income was linked to it. So those are two factors that kind of might come into play when we think about who's using ADAS most often. Oops. If you don't mind, I think Bonnie has put in the link for everybody this little poll, and I think it'd be really cool if you went to the link, and I'm assuming it's there, sorry, in the chat, and you will find a link to a group poll, and there's just 3 little questions in there, and it's just how many ADAS features do you have, how many in your car that you use the most, how many do you use, and what is your favorite one? Now, this isn't data. We're not going to be publishing this. It's really for ourselves. I think we have a pretty good group here. I'm not sure how many are in our group here today, but I think it might be over 50 people. So at the end of the presentation today, if you guys don't mind taking the 30 seconds at some point, fill that out, and we'll actually portray this results of this little data collection for you. Jocelyn?
It might be good at this point to just remind everyone that the types of systems that, you know, the types of aids to driving that are part of the ADAS.
Yes, so the ones that I talked about, so it can include like blind spot or whatever, or even adaptive cruise control, whatever extra features that were not in your car 10 years ago, but are now kind of there now. Which ones, how many overall do you think you have in your car, and how many do you routinely use? Okay.
And Reynald points out that it'll be important that safety features are standardized and not different from one vehicle to the next. And this is an interesting issue because the degree of standardization is actually quite limited. There's some standardization about what needs to be displayed, but not a lot of standardization about how. And I don't know if SAE Automotive, that will be doing the standards, are working on this problem, but currently there is not a lot of standardization.
We talk about that a lot, don't we, Jocelyn and Bruce?
Definitely. And Barb is asking about how our work intersects with the decision or recommendation that driver is no longer safe for an individual. And I think that we'll probably get to that a bit later in the talk.
Yeah. Okay. Yeah, I mean, that's That's really the $1 million question, isn't it? So what we're hoping is what we're going to develop as part of this program will be an additional, very objective way that people can gauge their driving, not just at one point in the future, but maybe all along, and so that we can track ourselves. And as Louise Brunel was mentioning, maybe is it time for me to go to that 55 Alive or some refresher course or car fit or something. So it's not something that we're hoping would be just one little point of contact, but that it'd be something that'd be really informative and helpful to us across our driving lifespan.
Okay, there are a few more. This slide is definitely engendering lots of interest here. So Tris is asking, does this graph mean that folks with cognitive concerns use the safety features?
No, so I was just about to get to this graph. So I noticed there's this weird, I see it. It's this red blotch at the bottom. I don't know how it got there on the slide. It just popped up there. But anyway, please ignore that. So yes, this basically is like a stylized model showing you what trends look like. And this is our interpretation of what the AAA was finding, was that they asked people about self-reported cognitive concerns. And as you go along here, you're getting more and more concerns. As you go up here, you're using more and more features. So this goes in a negative direction. So what we see is that as people reported more cognitive concerns and changes with their driving behavior, they actually used fewer ADAS features. So this actually presents us as a real opportunity. It's a challenge, but it's also an opportunity where we can say, okay, people who are reporting more cognitive issues with themselves are actually using less. And so when if people are identified with cognitive concerns, this might be somewhere where we might want to introduce training or really discover, what's happening. Why are they not using it? So hopefully that answered that question. Are there any more, Jocelyn, before I go on? Oh, you're muted, sorry.
Not directly related to this, I think.
Okay.
Yeah, there's some more questions that are more related to the overall project. So I think we can probably come to those more toward the end.
Okay, perfect. Great. This here. Okay, actually my little training one. Okay, yeah, I don't know why this red line is there. Sorry, it's annoying me. What about training? So I did mention that maybe that's the reason people aren't using them, using their features. And what they discovered was that about 48% of people figure out on their own how to use it. 20% would be taught at the car dealership, and then 11% the owner's manual, which I don't know how well that's actually going to end up training you, or 13% never learn to use it. So that also presents as another real opportunity and challenge there. So when you look into how people should be trained to use these, these safety features in their car, what turns out that, of course, you can teach in the car. You can have somebody, an expert, teach you how, and you can also have demonstration video. So there's some research that discovered that the on-demand demonstration videos were actually more effective than the in-car training. And they really felt that the mental workload when you're in a car, so the mental resources that you have to use when you're in the car learning things and someone's showing you, maybe they're touching stuff and you're just watching or whatever, that was not as good. Particularly for women, it was not as good. And when you think about it, anytime you use human factors, people will talk about this, anytime you use anything as simple as a toaster, all the way up to flying some F-18 jet or something, your mind has to develop this mental model or this schema of how you need to interact with this device. And in order to build a really good proper model, you need these mental resources to be available to you. And people build better models when they're actually learning on their own time. They can repeat things when they're learning with a video. And actually, that is a technique that we used in the study that I'm going to talk about, where we had everybody who drove in the actual vehicle, you saw the picture of the Lexus there earlier, and I'll show it again. They were given an instructional video to watch at their leisure beforehand, but they did have to watch it. And then once they got to the track, that's when we gave the in-car learning, and the in-car learning went very quick, we found, because people were given the chance to learn on their own. So the research that we're going to give you some findings from is it's pretty hot off the presses. It was a project we did last year for Transport Canada, and they have the results, but we've other than a couple things, we really haven't published a lot of this. So this is the first time we're presenting a lot of this. So we'll be eager to hear your feedback, and we're also very excited to show it to you today. So this study. This study used two methods, in-lab simulator driving, and it looks quite simple. This is kind of one of our earlier versions of it. We kind of prettied it up and had a little bit of material on the side to make it look more like a car, and we had this all blacked out, and there were cameras and things like that attached to it, but a very simple layout would look like this. We have an adjustable seat, and what's special about it is that it's really what we call age-friendly design. So it's the way that you set up the monitors, the amount of information that's on the screen is all designed to limit any negative symptoms of simulator sickness, because it can happen, and it happened to a couple of people. It can happen that you could start to feel queasy or dizzy when you're in a driving simulator, and this is a very well-known phenomenon. So we worked hard to make sure that people would not experience negative symptoms in this study. And then on the right-hand side, you can see that this is a kind of a side shot of the Lexus. We have some more video of it in a minute. And this we worked in conjunction with a place called Area X.O in West Ottawa. They were absolutely fantastic. Their expertise was just exactly what we needed. Whenever anybody was, a participant was driving, there was always, we had a researcher beside them. There was the engineer from the Area X.O behind, and then I was sitting in behind the driver. So, you know, safety, of course, would be of prime concern, and it really it went extremely well. Okay, so what are some of the questions that we asked our participants? And this is combining both the driving and the in-lab. Everybody was invited to do both, but and some people did both lab and track. But most people kind of did one or the other. So we have, these are kind of the unique responses we got from people. And you can see that male is blue and female is the orange color. And so that we definitely had more males in the study. And this is quite common that you'll find if you're asking people to drive out to a track, let's say, or drive in a simulator, something to do with cars and autonomy. You just typically get more males. And so that's what we found as well. But we asked people to rate themselves. And so these were the older drivers, and they rated themselves, you know, as quite competent, you know, either nobody was below the 3 if you go from like a 0 to 5 in terms of driving ability. You know, most people were here around 4 or even 5. So that's kind of nice to see that people were rating their skills. It's good. We also asked about what kind of features people had, and we're going to see if maybe we'll find similar findings today with your responses. So we could see that parking assist was, you know, the least available. What was interesting about the AAA study that I talked about earlier is that out of all these features, they found that parking assist increased the most over 3 years that people reported having. And this is just, you know, it's just a feature that's just becoming more prevalent in the vehicle fleet that's currently there. But we found it was the least, cruise control the most. But a fair number had lane departure, emergency braking, blind spot warning, and adaptive cruise control. So the people that came to our study definitely had experience with these autonomy features, and a couple people even had some Tesla, you know, Tesla, which had sort of actual self-driving ability. So we asked about now people's use. And what you can see is we kind of have a split going on here, fairly equally divided between male and female. However, you can see that we've got people who are using all of their features most of the time. And then you've got, people who are sort of using some of them some of the time. So there's definitely, again, challenges here to help people learn how to actually use the features that they have in their car. So we asked people also, when you're not using those features, why? What's the reason that you might decide not to use them? The first answer was lack of trust in them. Secondly, people reported that they just didn't know how to use them, or they just didn't, they just left that answer blank. So they weren't really sure, I guess. Interestingly enough, in this study, we did not study just older drivers. We also studied another what we consider a vulnerable road user group, which is novice drivers. And we know that, for example, things like accident rates and whatnot are both pretty similar between older drivers and novice drivers. And we found with the novice group, some indicated that they didn't use these autonomy features because they were better drivers in the car. That answer was not used by the experienced older drivers before they drove autonomy. After driving, about half of them thought that they drove better without the autonomy features due to potential system failures. So having the experience with it seemed to affect their trust. The car was quite reliable. It wasn't that, it wasn't perfect, but it wasn't like the car was driving into objects or anything like that. And like I said, we expected the car to behave safely, and it did. But this was just kind of an interesting thing, and it really brought up the issue of trust. Make sure. Are there any questions at all, Jocelyn?
Where people are asking about adaptive cruise control versus regular cruise control, what the difference is.
Okay, my understanding is that the speed will vary in adaptive to keep you at a safe distance to another vehicle. So in regular cruise control, it's going to you set it to 80 kilometers an hour and it's going to stay at that. Adaptive, it's going to use intelligent algorithms and optical, computer vision to actually maintain a proper distance. Bruce, do you want to jump in?
Yeah, well, I was just going to say, you'll never go above, if you use your example, the 80. But if, for example, you're on the highway and you're in the same lane and you're coming up on a car that's going 75, your car will slow down, ensuring you keep a safe following distance until you choose to go around them and change lanes. Okay. Versus, continuing to go 80 kilometers an hour. And if you don't override it, running into them.
Can I make a comment? It's Sandra Murray.
Sure.
First of all, it's just quickly, I heard a presentation, I'm sure it was you and Bruce, and there was another group that talked about sensors in the home. Was that through the Bruyere? Yeah. So
that's my research, or our research, yes.
Yes, and I asked to be involved. I was never called, but no, last summer, I did the driving simulator. I was contacted by the students and went and did that. And your comment about it being easy, it is easy, and there's no right or wrong answers. They were very, very good. The people that ran the driving simulator. The other thing you talked about, your car having these features that you're talking about here. I don't have a car, but I drive a rent-a-car. So it's Communoto. So there is an example of driving different cars all the time. And so that would be kind of difficult to, unless the whole fleet, was accommodated with those different features. So that would be something to keep in mind as well.
That's fantastic feedback. Yes. I mean, imagine if you could get in a Communo Comuna Auto car, and there's this little short video you'd watch at the beginning, and it says these are the, these are how you use the features. I mean, something like that would be great. So yes, but that's certainly an added challenge for you if you're driving different cars all the time. Absolutely, I can see that. And thank you for your feedback on the study. That's a great plug, because we are going to do more studies, and we would love to have those in our audience contact us. You can do that easily through our sensemd.ca website. We're going to show you that in a minute.
Okay.
Because we're going to do more. We'll change things up, but I'm glad you found it fun and enjoyed working with the students. It's such a great opportunity for the students, I have to say, at the university, the masters.
They were so nice, and there was not a lot of stress. Well, you put the stress on yourself. They kept saying there's no right or wrong answer, just take your time, and it was very interesting.
Great. Well, I think you'll be interested to see some of those results today then. Did you have anything else to say there, Bruce? I noticed. No. Okay. All right. So this really, what we found really brings up the issue of trust. And so people were saying, I know that mechanics could fail. I made sure to watch my surroundings. My vigilance was increased. People were very articulate about how they felt when they were driving, when the car was in full control, because we did have them drive both in the simulator and on the track. We had them drive in both what we call manual mode, and I don't mean manual like stick shift. We call manual is when the driver's actually driving, versus autonomous mode, and that's when the car is doing the driving. And it's no small feat. Bruce and his team worked really closely with the software group that developed our simulation software to get it to do automated driving, because this is not that commonly done. So it's kind of special about this work. So they said they were more aware of their surroundings, and they said, I was ready to take control if anything happened. And so that is actually one of the things that we did study. We developed something called takeover events. And the reason that takeover ability and takeover events are so important to study is, as Bruce said, for the next few decades, we're not going to have every car being fully autonomous. This is going to take a long time. So we're going to get to a certain level, and they call that level 3 autonomy in the engineering biz. And this is where the car might be able to do lots of its own driving and operations, but the human will always be important and be in the loop, meaning that at any point you might get a warning from the car to take over, or you could decide yourself, the car is not doing something safe and I want to take over. And in our experiment, taking over was very easy. You just grabbed the wheel and moved it a tiny bit or tapped the gas or brake, and then you were in full control. So we actually provided participants with opportunities to try these takeover events. In our case, we did not give them a warning. We just let the autonomous car do something bad that we hoped that they would notice. And people were given a certain amount of points based on how perfect that takeover was. Bruce, am I continuing at this point? I think so, eh? Okay. All right, so as I mentioned, this was the driving simulator. So I've already discussed it, and we had a great little plug there. Thank you very much, Sandra. And so in this driving simulator, these are our results. And you can see up here on the top right in the manual mode, we had there was a cone, and if it's kind of behind the scene now, but they were driving and there was a cone in the middle of the road, and they were to manage that cone. So in manual mode, they're driving and they see the cone and they have to manage it. In the other scenario, we had this bouncing ball come across, and in this case, you're in autonomous mode. So the car is driving, and if you don't respond to something, you could run into this car. Now, of course, we know as drivers, the car might not know this, but as humans, we know I better be very careful and stop, because there could be a child running behind that ball to go get it, right? So these are kind of points where we consider that a takeover would be required. So we called this driver engagement. So how engaged they were in terms of taking over. And here we have the novice drivers, the manual versus autonomy. And then we also have, for the older drivers, the manual versus autonomy. And we can see very similar kinds of patterns here, that there's it was less well done in autonomy mode and better done in the manual mode. I'm just going to show you a quick little video here to give you guys a taste, just a few seconds worth. I'm going to just minimize this so I can bring in a video. Here it is. And you're going to see what it looked like on the closed track at the area X.0 in the autonomy in the vehicle. So I should be at the right point here. Can everybody see this? Okay, I'm not going to maximize it at this point. I'm just going to let it play. So in a second, there we go. Oh, there is video. I did not think there was. So you can see the lights are going, and we didn't have the arms come down because we didn't want anyone to run into it. But in this case, the car was doing the driving. I'm just going to stop it. And it did not stop. The bells were going, the lights were flashing, and people were to notice that and conduct a takeover. And in fact, what we did have on a couple, at least one case, we had some people that just went right through. The older group, let me just bring this back. Actually, I'll show you the next one, which will be the ball. Surprise, now we've got people in manual mode. So they're doing the driving. And there's going to be this ball that comes out kind of from behind a parked car. Okay, so their job is to either stop, slow down, or kind of make sure that you're behaving appropriately with the fact that there's something rolling out onto the road. Okay.
So we have a question. Oh, sorry, go ahead.
I'll just quickly say, what's kind of neat, if I could flip from one slide back and forth really quick, you'd see that this bar really jumps up for the older drivers. And that was really interesting to see. So what happened is that now we have in the novice drivers, we have their scores are basically the same between manual and autonomous. But then we have in the older drivers, they did much better in the autonomy as opposed to the manual. And this really, we link this back to trust. They were extra vigilant. Now we have no idea if this extra vigilance would continue after they've been using these features for a year or more or whatever. Perhaps they would then become a little more relaxed and not respond to a takeover event. But this was a really interesting change in behavior that we saw with drivers in the autonomous mode on the actual road. Okay, some questions there, Jocelyn?
Yeah, just stepping back about the big picture. So Trish was asking, and I'm sure Trish is not the only one who maybe has this question. I'm still a bit unclear on the big picture. Is the Council of Aging a partner in the overall project? And what is the aim of the project? Is it to test driving ability? Is it to train people to use these features? And when would we feel like we have enough data?
Oh, okay, that's a lot of questions.
Yeah, these are all good questions.
Yeah, well, probably you never get enough data, mostly from the fact that we'd love to study people over time, so that the study's got another 2.5 years, so that's the most that we could possibly do. But yeah, so in terms of the Council on Aging, the older driver, or so the driver safety group, subgroup of your council are what we call knowledge users. And at the very beginning, we had a slide that was all our engagement. And these are what the project calls as knowledge users, so, and sort of consultants. So they are part of our core team that's giving us feedback as we go along, as we develop materials, as we develop plans. We want to run this by you guys. And we're really excited to have the Council on Aging work with us on that. And there was another part to the question.
So yes, the overall aim of the project, is it to test driving ability? Is it to train people to use these features?
So it's actually neither of those exactly. What we're developing is based on those really huge data sets that we talked about from CIA and CanDrive, to develop the algorithms that all the streams of data that will come from your sensors, that will be passed through these algorithms and then interpreted and really packaged into some really nice information about driver risk. So we're looking at that whole process. Along the way, because our labs study aging and complex behavior, we're also very interested in how people behave when they're driving in these with these features, because ideally we want these to be very useful as well. So we think the main point of our project is to develop the algorithms and develop the process where information can be delivered. But along the way, of course, we're learning a lot, and we don't want to miss any opportunities for learning. Bruce, did you want to add to that?
Yeah, I was just going to extend on the training people to use features. You know, I'm coming at this research on a longer term basis from the perspective of, you know, if I look at things like mobility assist, we have it's been built from the beginning around mobility assists, whether it's a cane or a rolling device or a wheelchair. You know, it's an option as people have a need, but it's always been built from a perspective of an assist, not from a perspective of I'm going to take over. My concern as an engineer is a lot of the autonomous features are built from a perspective of they're taking over. And I think to actually do what's there, and this is, you know, our physician friends on this project, because we have physicians involved, are actually coming at it from the perspective of how could they be assistive devices, in which case the train and use is a really good next step. But I think we have to come back and understand if they can be assistive devices first. And that's probably a next study.
Yeah. And we, in order to build, to build this whole model, we need to validate it against real driving. So that's why we have real drivers, the simulated and real track driving in this study. And when you have these drivers in the cars, these are questions that you really need to ask people. So that's why it becomes this really comprehensive question.
There was a question as well about cost benefit analysis for ADAS.
Yeah, so benefit, like we talked about, like there's maybe soft benefits. I'm less stressed. I'm driving, making driving a bit easier for me. Does that as a consumer equate to some value for you? The hard dollars and cents, this is the kind of thing that governments would look at, features in the car and then accident rates and things like that. And that's not known yet, but that's a fantastic question, I think.
Yeah, to answer Louise's question, as part of this project, we're not planning to outfit cars with especially cameras. That gets very costly very quickly in terms of setting up and establishing. I actually have full access to the data that Ottawa did, Sylvain Gagnon and that team. So we could actually go back and pull those data sets if we wanted to. Right. Sean Marshall is part of this research team and was part of that research team.
Yeah, and I think we kind of see that the real value in what we're doing, one of the real value pieces is that this data and these, identification of driver risk will be done without adding stuff to your car, because it's those sensors are there already.
So I'll just answer Rosemary's question. Came up live. Absolutely, we have full access to the CanDrive program. So thank you for being a participant at Lakehead. Michelle Bedard is a great person. That CanDrive was actually the lead institution on CanDrive was the Ottawa Hospital. And Sean Marshall, who is the principal investigator of that, is part of this project. And I'm one of the few people with a complete set of CANDrive data.
And that data indeed feeds into is what we work with in all of the analysis that Bruce is doing right now. And that feeds into the development of our SenseMD system.
Mm-hmm.
So it's a critical piece.
Very.
Yeah. Okay. The great thing that you've probably taken away from what we've shown you in data thus far is that we're not seeing that older drivers are really faring worse than the novice drivers. There will be some in a minute. We're going to show you where, yes, there's some what we expected. But I'm going to let Bruce talk now about what we did in the simulator.
Yeah, so this is just going through some of the data from the simulator. So one of the things we are always very cognizant of, I almost got that word out, in simulation environments is what's known as simulator sickness. So the basic model here is people are used to the fact that there's potentially motion sickness that occurs if you're in, bear rides and those types of things. There's kind of an inverse that can happen in a simulator where you're seeing things moving in your vision, on the screens in front of you, but your body's not moving and your body gets a little bit confused and it leads to something known as simulator sickness. So one, we have been very, very conscious in the design of the protocols and how we set up the simulators, et cetera, to minimize it. The good news here is it's hard to make it go away, but to try to make sure the symptoms, it can be nausea type symptoms, are minimized as much as possible. And the good news is the young kids actually fared a little bit worse in our study than the older adults. So it in the previous study. So we're going to continuously watch that. So we keep moving, I guess. Okay. So the observation here is one of the things we're looking at is, mental workload, self-rated. So what were people saying in terms of what they thought, the effort they were putting in from a cognitive standpoint for driving. And again, the results for the novice drivers and the older drivers were very, very similar. In the interest of time, let's just keep rolling through these. So situation awareness is, again, something we were asking them to look at. So the idea was, they would drive on the map, and they would drive on a map, which happened to be the map on the slide in the right-hand side. And they were basically asked, after they drove, where were they? And did they understand where they had come from and where they had got to on the map? And there's some differences in the older drivers being a little less accurate on where they thought they were in the map. The challenge, of course, here is it's a simulator map. It is a fake map. Nobody's ever driven in real life. Nobody's got any real knowledge of it or experience with it ever before. This is the first time you saw it. Okay. So let's just keep going. Perspective memory. So this is an important task. The analogy on perspective memory is if, I guess Kathy put the comment here is, if you decided that after this meeting, you're going to have to call somebody when you got out of bed this morning, perspective memory is remembering to do that when this meeting ends. So what we were looking at is, would the drivers be able to keep track of something unrelated to the driving task that they were being asked to do? And so the example was to push a button on the steering wheel every time you went past a cone on the side of the road, or every time you went by a road sign. Could they remember to do that task? And in this case, the older drivers fared a little bit better than the younger drivers at remembering to do the task. And there is a slight increase in performance in the autonomous mode, which is interesting, especially for the novice drivers. If you're not driving, you'd think you'd pay attention to this other task that you were supposed to be doing. They really didn't do a difference. Okay, so I'll just keep going, I guess. So this is a number of other measures we looked at. Again, this is now on the track. So basically, it's the same type of information we just went through of mental workload, situational awareness, perspective memory, except now it's, in the real world, you're on the autonomous track. the aerial view in the bottom corner of what the track looks like. If you're not familiar with it, it's across the road from the Sportsplex at Woodruff and Hunt. So again, we do see some difference here, situational awareness. Similarly, the older drivers were a little bit poorer, a little bit lower scored there. A lot of the other ones are fairly similar. So
this is a question Louise had, is like, it's interesting the differences being so small between older and novice drivers, and how do we account for that?
Well, I think novice drivers they're struggling a bit. So we don't have a control group of what you might think of as your control group of drivers who are not struggling with the issues of being a new driver, and they're not struggling with anything that might come across even from normal aging. So it'd be interesting to see if we had that middle group of, let's say, drivers from age, I don't know, 30 to 55 or something like this. That would be like your sort of more perfect control group. So we weren't super shocked that these were pretty similar, and we were expecting that youth would give an advantage for things like situation awareness. We thought actually it would give it an advantage because all the literature shows advantages for younger people over older for perspective memory. But except for in real life situations. So this was enough of a real life situation that they were equated between the two groups.
Yeah. Okay. I guess we'll go to the next one.
Okay.
Yeah. So, coming back to the slide we had at the beginning and just sort of reiterating what we are trying to do from the in-vehicle sensing and models that we're looking at is, I don't look at ADAS sensing from the standpoint of how is it going to drive for me. I'm looking at all of these sensors from the perspective of, if I'm driving the car, they can still measure what they're going to measure, and they can give us knowledge about what's happening in the car, even if they're not taking control of the brake, the gas pedal, or the steering wheel. So, the example would be is if we've got something that's going to measure following distance, well, it can actually give us a measure of how an average driver is doing their following distance when they're driving normally, etc., through all of them. So the model we're looking at is, how can we take some of this knowledge from the sensors that are becoming standard in cars, and use that to start and assess and understand how people are driving, and if somebody's driving behaviors are changing, most importantly in if a negative degradation in ability that's identified. So as an engineer, I'm looking at these sensors and how can we get knowledge from it, turning that into knowledge. So that's the analysis problem in the top right. And then the next step is, of course, how do we communicate that knowledge? Okay. You want to jump to the next slide. This is, by the way, the demographic population of what our friends at CAA have contributed to us to work with. They have provided us with 1 year of data for basically all of the driving for a rather large population of drivers. So you can see here that there's just short of 30,000 drivers in the population. Well spread across the age group category. So this will come back to the question that Kathy just answered. And I'll take some of the blame myself. I've been involved in a lot of research looking at older drivers, comparing them against the unstudied 30, 40, 50-year-old so-called normal driver. There's also a lot of work in the literature on novice drivers compared to the unstudied middle. We actually have a chance to look at the middle in this data set. And do some real comparisons. And I am so excited to see this. We have over 1,000 driver for every age group and gender from 30 to 90. 600 drivers over the age of 90 is just a phenomenal number. Can drive in Ottawa total was only 256 drivers 70 and above. So this is just a phenomenal data set to look at. We may discard the teenagers out of the study purely on a bias basis. It's a small group. And our criteria for these drivers would be single drivers, so a vehicle with only a single insured driver on it. So by definition, these are teenagers of a higher socioeconomic category, probably because they have a car of their own. So I don't want to bias to pop into the research there, but it is an absolutely phenomenal data set. And yes, it's over 1 terabyte of data. So that's 1,000 gigabytes. It's a pain in the neck to manage as we move it around, but it's exciting to work with.
Louise has a question as to whether we're hoping eventually to do this in real time to give immediate feedback to the driver so he or she can make corrections.
I'm going to say semi-real time. I'm probably not going to be making corrections. I don't think we're at the point we want to make corrections to the drivers while they're driving. But definitely I would like to see us get to the point where the knowledge is coming out of the system so that it can be acted on quickly, same day. Let's start at that level, right? Because there's a whole thing of alerting somebody while they're literally behind the driver's seat and surprising them, maybe not a good idea, but we want to get that knowledge quickly.
Yeah, I mean, there are general systems, related to fatigue and things like that, driver fatigue indicators that seem promising, but this sort of thing is an amalgamation of all sorts of different parameters, and so couldn't be captured.
Okay.
Real time.
I see Judy's question. So what kinds of data is in the data set? So the data set includes a summary record for every trip. So we have to be very careful here with anonymity because it basically tells us the beginning of the trip on a GPS location, the end of the trip, how long the trip was in minutes and seconds and kilometers, and various other things about attributes of the trip, like what different road types were used. So, was there 400 series highways versus, the Highway 7s of the world versus city streets, and a myriad of other data of that level, sort of giving us a trip summary. And in addition, we literally have at 1 second sampling rate for every second the car is running, we actually have GPS location, velocity, braking, etc. Basically everything that's on the dashboard recorded. So it is absolutely a phenomenal detailed set. And I will be very clear because there's a lot of data in there from a privacy standpoint that I am explicit with anybody who touches it around the issues of anonymity. Because yes, we know where the car is every second of its life. So there's a lot of details in there that I have very adamant to my students about access to the data.
Are there any other questions? We're kind of at our conclusion stage here. Some of the things that we think about is that, much more research is needed to determine how ADAS can increase safety for older drivers. Trust in ADAS must be addressed by the industry, as well as training has to be addressed, so that there's just these features are being used appropriately and in the way that's really increases safety the most. And I liked it that some of those training, the literature I read on training looked at factors that could really moderate these answers. So male versus female kinds of training that work best, or what's best for different age groups. I think there's not going to be one size fits all. I think this is important. It's things need to be customized. What we're also finding is that the older drivers are not disadvantaged when you use well-designed simulator and close track research. This is frequently a concern because in the past there was a lot of high dropout rate of studies with older drivers because they felt sick and whatnot. So even though the simulated world that you're driving in is not like, it doesn't look like Google Earth, and that's done very purposely. You can really minimize this issue. And again, coming back to trust, that whole interaction of older drivers with these features really has to be examined. We think that's very important, because with drivers staying in the loop, or that's the kind of expression we use. So drivers having to remain vigilant, engaged, even though the car is doing lots of stuff for you and your infotainment center is, distracting you, there will be times where either the car tells you to take over or you decide that you have to take over. And, our skills need to be maintained through our driving years to be able to do that.
And there was a question about where to go to have an assessment regarding driving abilities during aging.
Well, maybe Louise, you want to answer that one? Because that's you probably have some good suggestions for that. Where do people go? I mean, you can ask for driving. I mean, there's different software systems out there like DriveAble, and there's people who do that, but maybe there's a one-stop shop for that information here in Ottawa, Louise.
Although I would not mention DriveAble, we have some like if you want, because of a medical reason, if you want a functional driving assessment, you look under the Ministry of Transportation for Functional Driving Assessment Center, and they are listed. I personally, no, actually, DriveAble, I think, doesn't exist anymore in Ottawa.
Okay.
There is a functional driving assessment center or department at the rehab center at the general hospital. And the person there has a lot of experience, and you will have like written, and you will also be taken on the road. As the issue with DriveAble in the past, although I believe I looked at that recently, and I don't believe they are in Ottawa anymore. But DriveAble was came from a research from Alberta, Dr. Dobbs, and he created a software. And the unfortunate thing, often the assessment started with that software, but depending on the result, they would not take somebody on the road. So as normally with the functional driving assessment, they do have clinical assessment, like written assessment, but they will take you on the road also. They will start with the residential area and then build gradually to busier area. So you will be taken on the road and see, and then it will, like your driving will be assessed, and then they will see if you can with lesson, if you can improve, like if there is way, like if improvement is needed, they will look if you need lessons, and if you need lessons, then they will observe you during the lesson and see if you can retain the information. And then so basically you have a scope of possibility. So, but the thing is to look under the Ministry of Transportation functional driving assessment if it's related to a medical issue.
Yeah. And I think at a certain age, I believe that the Ministry of Transportation will do some little bits of tests, special tests with you once you, I think 80 and above every 2 years.
80, yes, at 80 and every 2 years, as of age 80, you have to go to the drive test center, and it's in person. They will look at it's a group session, and only some people that would. And you have it used to be 2 written tests there, and it's only 1 now, the clock drawing test. It used to be the letter cancellation test, but it's no longer, only the clock drawing test. And depending on the result of your participation in a group and the written test, You might be taken on the road, but otherwise you're not being taken on the road. Your license will be renewed.
Right.
So there's a couple of questions, Kathy, about the insurance side. And I figured I might answer them in audio because, right, clearly we're not hiding it. CA Insurance is one of our partners because it's a data set. So, if, for example, you are a CAA pay-as-you-go client, that's the same data set and sensor we're actually literally working with. So they are engaged in the project from a number of perspectives. And so, how is the data that they're giving us going to get used with respect to insurance? It won't make any difference because they're still using the data that they're collecting from your car for the reasons they already put in your policy. We're not going to do anything that'll change that at any level at all. What we are looking in more is the aggregate of knowledge that we can gain from it. CAA is very intrigued with this, and this will come back to the education question. One of the people from CAA is involved is their member services person. And she's very interested in, if I get an understanding of how some of these features can be better used, maybe CAA can step in and start to do some of the education, which I think is a very positive thing. And the other perspective from the insurance company is not from we want to take licenses away. They're business people. They don't want to lose customers. They actually are trying to figure out how they can keep people driving longer, safer, because that's actually in their best interest, obviously, to keep collecting premiums. And it's in the best interest of the person to be able to maintain independence. So hopefully I answered that.
Mm-hmm. And everything is 100% anonymous, right? There's the data is completely anonymized. So not even CA, we don't want to know, we're not going to know who these actual individuals are, and CAA will not get that information either.
There have been a couple questions about what to do with, increasing aggression and more tailgating and, what people are driving like nowadays on the 400 series highways, and, how that should be approached by an older driver.
Yeah, I mean, that's a question that everybody, I think, of any age struggles with that. And sometimes what people will do is they'll really change their driving habits so that they're on the road where it's less busy. If you're finding these things are, you're really getting bothered on the road, then people will change, when and where they drive. They'll stay off highways, they stay off at peak times to help you manage that. Eventually, when the cars are doing things like adaptive cruise control and people are letting their cars be in control, this should eliminate a lot of aggressive driving that's out there in the public anyway. So, I mean, that's going to take a while to filter down, but yeah, hopefully that's I don't have a single answer for that, but there might be some other opinions out there, some thoughts on it.
It's a good question. I have no clue what the answer is.
Yeah.
And there was a question about what we were looking for when we asked people to indicate on the map where they had gone.
Okay.
So this is situational awareness. You can answer that, Kathy.
Sorry, I'm getting over laryngitis. My apologies. So what about the map question? Sorry, I didn't hear the whole question.
What were they being asked to do in the situational awareness question?
They were given an actual piece of paper that had like a bird's eye view of the entire environment. And they always got the same paper. So wherever they saw where they marked themselves each time. So that was giving them clues as to, where they were. And they literally marked on it. And then we had this objective marking scheme, this template we overlaid so that everybody was marked with the same stringency.
So the score was basically proximity to the right answer.
Yes, the closer you were, you didn't have to have a perfect score. I'm sorry, I'm still not getting your question.
Yeah.
It was we made it a range, so you could have 0 if you were way outside of the range, and then as you got closer and you were within a reasonable distance from where you actually were, then you would get full points. So it was not an all or nothing kind of thing. Yeah.
So Louise is just commenting that it involved visual memory and spatial relations.
Mhm.
Absolutely. Yeah.
I want to make sure, though, that we answered Barb's question that she asked right at the beginning when she was asking about how our work intersects with the decision recommendation that driving is no longer safe for an individual.
Want me to take a shot at that one?
Yeah, sure.
I'll put my virtual Frank and Sean hat on.
Yeah, we all have our opinion on that. Yeah.
Yeah. So I'll answer that slightly from a different standpoint as the engineer, but two of our research collaborators on this project is Dr. Frank Knuffel and Dr. Sean Marshall. So Frank is with the Brayer Memory Program. Sean is acquired brain injury, is his physician practice. And both of them will not give you an answer to that because that is a question both of them have as part of their practice. How do you, Louise just made the comment about the clock test, right? They are continuously looking at the tools they use in the clinical practice on which they're making decisions to, write letters to the Ministry of Transport to recommend, a license suspension. They are both looking at that from a standpoint of, can we do this with better knowledge and better data? Okay. And that is one of the reasons why Brayer is the proud owner of $250,000 worth of driving simulation technology for research purposes, because that is actually their active clinical question that they are starting to do studies on with us in parallel, which is what is the role of real driving knowledge in that decision making? So the answer to your question is future tense. We're trying to figure it out.
Yeah. That's it.
So,
that's it in a
so-
nutshell. I mean, I'm just sorry, guys. I just pasted in a link in case it's not there.
I was going to respond to Barb. Absolutely. I think one of the most eye-opening discussions I was ever in is, again, in my research group, we run a community advisory committee. So it's a group of older adults, care partners, etc., who have been together for many years. So they have a lot of personal interrelationship trust. Frank asked the question one day in that meeting about the, giving up driving questions. And every single person in the meeting had a family variation of the horror story, right? Of siblings no longer talking because somebody was the child who took dad that caused dad to get the license suspended, etc. So that is first and foremost in all of our research, is that driving decision is huge and life-changing.
Yeah, and hopefully one of the benefits of this technology that we're developing is that, first of all, you're going to have your knowledge of your risk, how it's changing over time. So as I mentioned, it's not just something that you want to hear at one point in your life. You want to know how your skills are, if they're changing at all, or if your risk is changing over time. And then that gives you all these intersection points where you can go and do something about it. So, the car fit or refresher courses. I see so much opportunity for more of these learning opportunities for older drivers and assessment opportunities for older drivers, so that the decision, comes a little bit easier. It's never easy, the whole driving cessation or driving retirement or hanging up your keys. We're a car society. We're a society of mobility. So that it's never easy, but we're hoping that by having knowledge earlier and more objective knowledge sooner, people will be able to make decisions appropriately. But it's not going to solve every problem like that's going to come up. So, Jocelyn, do you want to finish off with our opportunities for feedback? I just put the link to the NRC experience, experts by experience, in the chat. So if people want that.
Yeah, so in the description of the Aging in Place Challenge program, the NRC's program. If you look within that page, there's going to be a spot where you can submit your interest in being an expert by experience. And that's not just for this particular project, but for a bunch of interesting projects. And, you know, you're not obligated to do anything. They'll send you information. You might be, you know, requested to participate in a study. As well, there's a question in the chat for Louise about volunteers for the committee. And I think it's best if Louise answers that one. About what would be some of the activities volunteers would do to support this project or other driving type projects. So for the committee, I can't really speak to that part.
Yeah, well, we often go by someone's interest, and it depends on your availability. We have a meeting once a month. One thing that's quite popular is related to car fits. Some people are, like, for example, not necessarily a member of our subcommittee, but they want to participate to be car fit technicians. So we have Barb, who is on this presentation today. I saw her name come by. She is a car fit technician, so she help us out whenever we have a car fit. So if your availability is just a few times a year, then you might want to become a car fit technician and then participate only when we have car fits. So we kind of fit your schedule whenever we can. But as you see, it's a very popular topic, the driving, and we need more people because the Council on Aging too, with their new terms of reference, we cannot, like, I cannot be chair forever. I cannot be like the Chinese president there, like holding the spot forever. So we always need new people. So we go with, we try to go with our needs and what's interests you, what you're interested in, what time and availability you have. So we welcome anybody.
So from the perspective of this project, I'm just so happy to see all these amazing questions, and I can see that there's a lot of interest amongst this group, and I see that there's a lot of knowledge. There are a lot of good points, people talking about standards and how standards could be implemented, what types of standards would be useful, these sorts of things. You know, there are things that I really hadn't thought of to see. So it's really, really helpful. So if you're interested in continuing to engage with our project as we move forward, we're just in year 1 of a 3-year project. You can go to the SenseMD website, www.sense-md.ca, and we'll keep you up to date as to what, there'll be lots of opportunities posted there for engagement, things like focus groups, other forms of consultation, there may be surveys, all those kinds of things. Plus, you can also just contact if you have more questions that occur to you afterwards. You know, you can definitely, there's contact information that Kathy's showing us right there on the website. And you can, please, we would just really, really love to have your collaboration. We're also interested in making sure that there's some diversity in who we are getting our information from. So if you know, we might need more people at some point from rural areas or more diverse backgrounds, and that's important to us as well. Even language diversity.
Yes, yeah, exactly. So yeah, there's plenty of opportunity to participate. I just wanted to get into this poll here because I promised that we'd look at our poll results. So I'm just going to get into there. Just 1 second here. I'm gonna try to get this off screen. So I don't know if there's any other questions you're going to want to chat for 1 second. I just want to take a second to see what kind of interesting findings we might have with our poll. So that's just going to take me a sec. So please talk amongst yourselves.
Well, I'll take the opportunity to thank you for this presentation. I think it was very interesting, and I'm very thrilled to see so many participants to this topic. And I think too, one thing I like, not only the information you gave, but also it was always almost a dream of mine to see the research sector coming closer to the community. I find it was two different worlds, the community and the research sector. And I always wish that it came closer to get results that are more pertinent to individual, that can help individual rather than corporation. So for that standpoint, I'm very happy with this presentation. Thank you so much.
You're very welcome. And these engagements with the community is just, it's really the crux of our work. It's so important, and we can't do it without it. So thank you everybody for attending, and thank you for all your feedback and your questions. Let's see what we have here. Okay, so we have, how many features do you have in your car? We have the biggest group by far saying 0. Okay, interesting. And you know what I think that shows us is that the people who volunteer for our studies are people who are like really into it because they have these features, right? You tend to get people who are just like, oh, I've got these features in my car, I'm going to sign up. So what we really love to see is a cross section of all older drivers in our future work. So not just people who use them, but people who, you know, like this great crowd here, a lot of people who don't have them. So this is actually, it brings out a very, you know, key challenge that anybody has in research, is the self-selection bias in studies. So people self-select who goes. We don't pick people, it's open to everybody, but the people who select to come, same kind of work in our aging and pilot and aviation studies. You get those who are really into, maybe have their own simulators, and those people will come out. It does tell us when we do see effects of age, then we know that that issue is probably even more prevalent in the much greater, the bigger society. Okay, so we have really spread out then, that some people, you know, maybe 5 or more, but not many. How many do you regularly use? Well, of course, that's, I guess we know that's going to be around the same percent, because we've got a lot of people in the group not using it. But we can see that people who do have some, you know, we've got same kind of thing that I think we saw before. We have some people using some of it some of the time. And what we saw in the lab is kind of similar in terms of use. And then the favorite feature, okay, people don't have one. Assisted reversing, see if it'll give me cruise control, blind spot. That's definitely one of my favorites. Yeah, so we saw a lot of that. I think that's interesting. Assisted reversing and blind spot, those are my 2 favorite too. Yeah, those, I mean, they're incredibly helpful, but there's just going to be over time more and more and more of these features available to us. And if we can find a way to somehow learn how to use it, I think it's going to be advantageous to all of us. Thank you everybody for your responses there. Okay, do we have any? I'm going to maybe stop sharing. Okay. Oh, now we get to see everybody. So yeah, we're finished with our presentation, and thank you again.
Well, thank you so much again. Yes, I think it was really, and I think I see in the chat that people have been quite delighted with the presentation, and I am also, and as I said before, like I really find that coming together the research world and the community, and feeling that it can be meaningful in somebody's personal life. I think it's key really to research in the future when dollars are scarce. So to have practical application to research.
Yeah. Yeah, and it's to us, it's the most exciting kind of research, there is. We do very discrete kind of lab-based cognitive studies as well, but this, where you're actually having people in the car, to me, that's just the most rewarding. It's challenging, but the rewarding kind of research. Somebody asked about how you could contact us if you're interested. Please go to the website, very easy to get to. If you type in sense-md, you'll find it. We've got it under a couple urls.com.ca. It'll all make it there. And if you go under contacts and consult, opportunities, you'll see that you can send something to my email. And there's multiple ways that you can communicate. I'm going to try to make one of those in-page forms that you people can fill out with their name, address, and question. I just haven't figured out how to make one yet, but we'll do that soon.
Well, thank you so much. That completes the presentation part, and now just the older driver subcommittee will have our meeting. But thank you so much, everyone.
You're welcome. We'll sign.
And I'm really pleased that it was well attended.
Thank you. And if you guys don't mind sending us the transcript of the chat, then we'll have those questions. That'd be so great for us.
Okay, thank you so much.
All right. Bye-bye.
Bye-bye.